Iraqi. I'm a dermatologist. Today we are going to have a session for the dynamic wrinkles of the forehead, including baby botox and botox. Baby botox will be very effective in giving more brightness to the forehead, and the botox will work on the muscles that give the wrinkles H shape. ممكن نضم حواجبنا على بعض. Here our client is frowning. We will put marks on the areas where there are wrinkles. This is illustrative video for doctors only. Also, I want ارفعي حواجبك لفوق. Also, when she elevates her forehead, there will be these wrinkles. Sometimes I don't prefer injecting in the lower fibers of the frontalis so that there will not be a droopy forehead here that will affect the sight and the eyelids. In this area, which is above the eye, I prefer injecting high upwards so as not to affect the frontalis, which is responsible of elevating the lateral part of the eyebrow. So okay, here we go. I prefer injecting here according to the muscle bulk from 2 to 3 ml, and what I'm going to say is very important. The depth of the injection here, I prefer it deep, but when we go to the procedures, here it will be intermediate depth injection, and here I prefer injecting very superficial. This part, if we inject deep, sometimes we affect the lower fibers of the frontalis. That might lead to a droopy forehead, which will affect the opening of the eye. Okay. نرفع حواجبنا لفوق. Now we'll inject here. ارخي تاجرس. Okay. Here I prefer injecting superficial. Again, this is illustrative video for doctors only. Because the lower fibers of the frontalis somehow strong, I will inject here like superficially, so as only to affect the myofibrils in the skin itself. Now also baby botox. Notice the blanching. Wait please. The blanching and the whitening. This means I am strictly intradermal. بتحبي ترفعي طرف حواجبك لفوق؟ لا تحبي ارفعه لك بالبوتوكس ولا مش حابه نرفع؟ Okay. I always remember, dear doctor, to ask your client whether he or she would like to elevate the lateral part of the eyebrow, which is the gives the eye the eyes widely open. Also, always remember to check if the patient wants the muscles of the forehead to be strictly wiped, or some clients prefer to have some expression, which will lead us to decrease the amount of Botox. The touch-up is usually after 2 weeks from the injection. Thank you for watching this video. Thank you for following me, and wish all my dear junior doctors all the best. I'm Dr. Mohammed Iraqi, a dermatologist, and see you in the next video.